Share with you some information about that I saw on Twitter. Somebody posted that the Center for Disease Control, the CDC, has stopped disclosing the number of Americans tested for coronavirus. On the left is how the website looked last night. On the right is what it looks like now, with the testing info removed. The lack of testing, he says, is a scandal. This is a cover-up. So, that could be the case because, let's face it, the US President Donald Trump is not the most competent person in the world, and he also does not give a toss about the citizens of the United States. He cares about his business buddies and billionaires and his backers. So, this is sort of concerning, and the CDC is underfunded, so it probably does not have the ability. It doesn't have all these tests to send out to various hospitals, and apparently the first lot of tests that they sent out were faulty. So, there'd be people that had been tested and maybe it said that they were okay, and it turns out they were not. And this is where when you have a sovereign economy that is only used for imperialist wars, and they ignore the people of that country, and when corporate-owned politicians ignore the citizens of the country, and they won't give them Medicare for all, and they don't fund as they could. They fund wars, but they don't fund the CDC. They underfund it, and they cut out programs that end up sort of affecting everybody, their health and all of this. This is what happens. And this coronavirus will probably take hold in a major way in the US between the lack of testing equipment, the fact that people will not be going to hospitals because they cannot afford it, because there is no Medicare for all. The fact that the government and both sides, both parties, don't want anybody remotely progressive in government, and so they're doing their absolute best, along with the corporate-owned mainstream media, to prevent people like Bernie Sanders from getting anywhere near the office of the President of the United States. And Bernie Sanders would give people Medicare for all. He'd do his best to do that anyway. And also, all the mainstream media pretend like this Yale study that says that Medicare for all would save the U.S. $450 billion a year and would save 70,000 lives on top of the lives that the ACA has saved. So, there's the fact that there is no Medicare for all, and poor people will suffer the most because they won't be the ones going to the emergency rooms when they have these symptoms of coronavirus, and they'll continue to work because they cannot afford, because they're probably, a lot of poor people are they're not even getting a living wage, and they have in the United States, and they have to work 2 or 3 jobs, so they'll be going to different jobs and spreading the virus. So basically, these are some of the points that will help spread this virus: the lack of decent health care, the lack of governments, the sort of politicians that are in these days that only care about their corporate buddies and don't care about the public. They don't care if 1 million or so people die. Poor people, great, that's just 1 million quote-unquote useless eaters, what the Nazis used to call disabled people, useless eaters. So that's what they consider poor people to be, disposable. It's the politics of disposability. And everybody will be affected. This is what's these silly politicians don't even realize that they have to be out on the streets occasionally. They're not always being chauffeured around. Maybe Donald Trump is, but I mean, people in the White House go home and they mix around with people in New York. And I'm pointing out New York because I'm going to tell you a story of someone who went to a hospital and they think they have coronavirus and they were sent home because they didn't have any testing kits or something. This is somebody in Brooklyn. So anyway, I'm going to share this with you. I saw it on Margaret Kimberley's page. She's from the Black Agenda Report. I don't know the veracity of it. I cannot verify who this person is, but it sounds like the real deal, and it sounds in keeping with this thing that the CDC has sent out faulty kits, but also doesn't have enough kits because it's underfunded. And so there's probably a lot of hospitals are getting that same message that this fellow got, to go home. They limit. Anyway, I'll read this and you'll see what I mean. So this is kind of scary, and I'm not trying to be fear-mongering or anything, but I just think this is something to keep in mind. My COVID-19 story, Brooklyn. Hello, I'm giving a heads up to what I and my doctor both considered a very effed situation. I just spent a week in Japan, a country at high risk for COVID-19. I wore a mask and essentially tried to stay away from most touristy places, not my first time there. But trains and stations are still packed with people, so there's really not much you can do. On arriving back to America 3 days ago, I developed 102 Fahrenheit fever, coughing and aches. I went to a local hospital in Brooklyn, New York's ER, emergency room. I informed them of my travel. They provided me a mask and redirected me to a private room and followed infection protocols. Full face covers, gloves, aprons, etc. Now, I hope that these hospitals have a negative pressure room where you're keeping the virus within a room. Who knows if they have these negative pressure rooms, but I mean, if it's just going into the main air conditioning system, then it can go all around the hospital. I don't know. In hospitals here, the protocol is to basically, the patient, if they suspect they might have coronavirus, they actually ring up the hospital and prepare them, and then they come, and then I think they're assessed outside, and then it goes from there. Anyway, and our government, by the way, has been as slack because it's a right-wing, Scott Morrison is a right-wing wannabe authoritarian, and he doesn't give a toss about the public. I don't know who voted this man in, but he's a horror story. Not that the Labour Party, the other major party, is not also really problematic, but this guy is just awful. And the sort of thing where he says climate change, we need to adapt to it. He's not going to do anything about it. He's telling Australians to adapt to it. And you heard this terrible stories that went on during this summer, everything bursting into flames. Anyway, so that's the sort of PM we have. But anyway, fortunately, he finally got round to doing something. But, this is the thing. He sat on his hands and didn't do anything for ages because he's an idiot. I'm sorry, but he is. Well, probably he isn't an idiot, he just doesn't care. So I had a chest x-ray and testing for flu, cold, pneumonia, and about 25 other viruses. They all came back negative. At this point, the hospital called the CDC requesting permission to perform COVID-19 testing. The CDC denied the request on the ground that I did not have the most life-threatening symptoms, chest pain and shortness of breath. Now, COVID-19 can take a month of incubation, and meanwhile you can be spreading it around to people. So that's the first problem with that sort of suggestion by the CDC. And the second one, he says, according to everything I read, it's very likely not to have these symptoms if you're in your 30s and relatively healthy. So, there's two big problems there. And that was that. They discharged me and said I don't have coronavirus since they didn't test me for it, and said I can ride the subway, return to work, do whatever I want. See, that's really frightening. They basically eliminated all those other things and then said, you don't have it. Well, what does he have? At a time when this coronavirus, COVID-19, is spreading around, if they've eliminated all those things and then they send him away, what does he have? I mean, they should have at least suggested that they should have quarantined him at least for a while. In a negative pressure room. I mean, this is crazy. See, this is where, in a command economy like China, the government can actually do something. They built 2 hospitals in 10 days. 2 hospitals in 10 days in Wuhan. So they could quarantine. Now, I think it's stabilizing in China, but it's spreading around the world. And this is what's a problem with corporate-owned governments, inverted totalitarian governments, that they don't have any care about the public whatsoever, at all. People are becoming completely irrelevant to them. The politics of disposability, they're just irrelevant, and so they don't care really if a whole lot of poor people, and it's going to be poor people mostly because they won't be able to afford, as I said, to go to the doctors, to the hospitals. And they won't be able to, like Nancy Pelosi says, they're going to provide affordable, in quotes, vaccines. Well, anybody who's actually doing 2 or 3 jobs, they're poor. Affordable, when they're living hand to mouth, affordable is relative, because they may only just make it to the next pay packet, or maybe they don't. It only takes one. Most Americans don't have a $600 fallback if there's an emergency. And so, this affordable thing, people will take their chances because they won't be able to afford it. In a sovereign economy, they could afford to provide every single person in the United States with a free vaccine. But they won't do it, and they should do it, because this is something that if they cared about the public, If they cared about their own lives, they would do that. So it's kind of appalling, and this is where Medicare for all is essential. And but they're going to cheat Bernie Sanders out of this nomination, the Democratic Party, because they'd rather see Trump in office than have anybody remotely progressive anywhere near the office of the President of the United States. That's the sad fact. And I think Trump may end up getting into office, and then he's going to see it as a mandate, and it's going to be dreadful. But that's another story, and I've talked about that before. And by the way, the reason I talk about Bernie Sanders so much lately is not because of Bernie Sanders. It's because this is an example. How they're treating Bernie Sanders is an example of the sham of this so-called democracy they have in the United States that they're trying to spread around the world, this nonsense of spreading freedom and democracy when their whole electoral system is a sham between superdelegates and, getting rid of ballots and electronic voting machines, and the DNC basically saying that the public have nothing to do with who they decide to pick in the end. The list goes on. I mean, it's a sham, and they have the audacity to go on about other countries, Venezuela and all of that, who actually have fair and transparent elections. And here's the United States going on like this. But anyway, so I'll get back to this. So he said I don't have the coronavirus since they didn't test me for it, and said I can ride the subway, return to work, do whatever I want. I already read that. Fortunately, he has a doctor who's sensible. Of course, my doctor disagreed. She said I should treat myself as if I'm infected. My partner is currently staying in a nearby hotel since we live in a studio apartment. I'm choosing to perform a self-quarantine for 14 days. I don't know if 14 days is enough, but anyway, at least he's sensible enough to do that. And the poor guy who's feeling probably very sick is basically alone, really. He's not getting any health care. Fortunately, I can work from home and my partner can deliver my groceries if I run out. Yeah, but I mean, he's sick and he's got to cook for himself and all of that. It's really sad. But I don't think that many people are aware of the fact that they're actively not testing people for COVID-19, even people who have a travel history to high-risk places. Now, he's continued on, and like with this frequently asked questions thing, he's put edit to answer some standard questions. Do I have symptoms? Yes. A fever is current 101.6 as of a couple of hours ago. Aches and a cough that is persistent. I'm taking Tylenol and drinking a lot of water. Is this real? It's as real as I said it is. I returned from Japan. I'm sick. The symptoms are similar to COVID-19 and I was refused testing. You can believe whatever you want. I don't care. Do you have the flu? Well, not according to my screens, I don't. Edit 2. I've taken some media inquiries lately, and he links to abc7ny.com. As I said, he lives in Brooklyn, New York. Edit 4, answering some additional questions. Didn't the CDC just change their guidance? Yes, the CDC added Japan to the list of high-risk communities, as high-risk countries on February 27th evening. I went to the hospital on February 27th morning. I performed a virtual follow-up visit with an ER doctor February 28th at 7 p.m. to go over my case with the updated guidance from the CDC. According to the ER nurse, since the hospital still can't hospitalize me based on my criteria, they can test me. So effectively, there is no charge. Were you supposed to go to the ER? I called up the ER before I went, told them about my travel symptoms and suspicion. I asked the receptionist what the protocol was, and they said, just come to the ER. Similarly, I asked them how I should get home, and they said I was fine to take any transportation I would normally take. That's very strange, and there's not even any mention here. I don't know if he's wearing a mask while he's going out. I hope so. And they should have said that to him. I hope they said to him he must be wearing a mask and basically try not to touch anything and try to keep away from people, even though that's pretty difficult in New York City. But I just think sending him away, I think that's a real problem. This is the thing. It's like, and hopefully he can afford to go to the hospital because, anyway, but he goes on. I have already been contacted by over 15 media organizations, so I can't respond to them all. If I have the strength and energy, I wanted to do a couple of local national organizations. However, I'm not talking to organizations who can guarantee that they'll protect my privacy and take it seriously. I need to disclose a lot of personal information, hospital records, occupation, residence, etc., for them to verify and run my story. Also, doing Skype interviews while chain coughing into a headset in my dirty room isn't my best weekend activity. So that's the guy there. That's really all I wanted to share with you. I'm not trying to panic anybody or anything, but this sort of goes, when I saw that thing on Twitter where, he said that the CDC had removed certain information and about testing, and then you see that, and knowing how it's like a dog's breakfast in many ways, the US, with all the different states in various states of disarray when it comes to, they've all got different protocols and everything, I think that's how it goes. And like I said, with China, with a command economy, they can immediately take action and just start building hospitals. Just put the money into building a hospital, do it in 10 days, voila. And there it is, and that's the way you deal with things like this. And the sovereign economy of the United States and other Western countries could do that. This is where, people don't quite understand how a sovereign economy works. I ask you to look at the hashtag LearnMMT and go and visit StephanieKelton.com. Stephanie Kelton, Dr. Stephanie Kelton, is Bernie Sanders' economic advisor, and she's a proponent of MMT. And MMT is simply a description of the operational reality of a sovereign economy. It's not something made up. It's not a theory. It's actually how the sovereign economy functions. And she talks about how it's so, it's completely, as the Yale study said, Medicare for all is completely doable. And so are a lot of other things. And that's why you'll never ever hear anybody say, how are you going to pay for it, when they're talking about wars. They know how to pay for it, and it's not an either or. They could have these wars, which are awful and shouldn't be happening, and they could do Medicare for all in a sovereign economy. And Stephanie Kelton talks about she's even written a book about, it's called The Deficit Myth. But look up Stephanie Kelton on YouTube. There's many videos by her, and she talks about the deficit and how there's a lot of fear around that, and how if you put the budget into a surplus, you cause a recession, and if you also take away from the public, social programs and stuff. Anyway, I'm not going to go into that anymore, but please look that up. But anyway, it's a frightening thing that the CDC is not even posting any testing. There'll be a whole lot of people just like that man who is sent home, and meanwhile they're spreading it around while they're on their way home, if they even get to the hospital. And so I won't repeat myself, but anyway, that's all I really wanted to say. And this is why the U.S. needs Medicare for all. This is why the U.S. needs a decent leader, which they have not had for a long time, and that includes Obama. Although Obama may have responded better to this situation. So anyway, that's all I wanted to say. So thanks for watching. My name is Trish Roberts. You're watching Fancy Signals from Vega. Please subscribe if you haven't already, and click the notifications bell. Otherwise, you won't receive notifications when I drop a video. Thank you for watching. Please leave comments if you wish to, and please stay safe, keep healthy, and think about going vegan for the animals, because they're not our property. But also, if you have an alkalized system, your immune system is in a much better shape when you're eating a plant-based diet, whereas animal products literally, and this is science-backed, literally cause inflammation in your system, and you're constantly assaulting your body with inflammation when you eat animal products. But it's actually not the case when you eat a plant-based diet. But the reason we should go vegan, of course, is because non-human animals are not our property. Anyway, so go vegan, and thanks for watching. Till next time, bye for now.